My name is Nunn, and I'm here to talk a little bit about healthcare and to also issue a challenge and to motivate all of us to make some decisions that can help us make a dent, make an impact in today's healthcare system. To kind of get started, I'd like to give you a little background on myself and why I'm passionate about healthcare. When I was born, my parents were not of the typical childbearing age. My father was 56, my mother was 40, and I was the last of 4 children. I have 3 older sisters. So when I just showed up one day, it was kind of like, for my sisters, it was kind of like getting a new toy or a new pet or something like that. They were really excited, a new plaything. And there was a lot of hazing going on as well. I mean, I got dressed up, I got made up, I got tossed around, and so it was tough to be one of only 2 males in my household. But because of that, I had a really strong relationship with my dad. He and I were best friends. And when I was 14, my father was diagnosed with cancer. And 6 months later, my father passed away. Now, for a 14-year-old to lose his best friend and his father at the same time, it's very difficult. And it caused a lot of questions to just fly through my head, and why couldn't we fix this, or why couldn't we prevent this? Well, just tons of questions at that age. And today, those questions still motivate me. Those questions are one of the reasons why I'm here today and why I'm doing what I do. I'm here to talk about the issues we have in healthcare. And there's a lot that we hear about, especially right now with the presidential election. We're hearing a lot of different things, cost and policy, and there's so many real issues when it comes to healthcare, but there's one thing that we don't talk about nearly enough, and I think the real problem with healthcare is us. And what I mean by that is we're disconnected from our healthcare, and we're disconnected from our health. Let me give you an example by asking a few questions to our audience here. By show of hands, how many of us know our blood type? It's not bad. You guys are pretty good. How many of us work out at least twice a week? Okay. How many of us actually shop for our health care when we're asked to go to the doctor or have a procedure? Disconnected. Now, how do we become disconnected? And to understand how we become disconnected, we have to kind of look at the history of healthcare, and I'll give you a very brief history. In the 1920s, physicians started to get expertise. Their skill levels were going up, and they were able to charge more for procedures. They were able to charge the wealthy more to get access to quality health care, and those without means were just kind of out of luck. And so at Baylor University, Baylor Hospital, they started this nonprofit program that helped those who didn't have the means pay for their health care. And that was really the beginning of what is now known as Blue Cross Blue Shield. Now, it was a nonprofit, but then for-profit companies and entrepreneurs saw the opportunity to start companies and do the same thing, the same business model, and make money. And so then you had the advent of the health insurance industry. Now, fast forward to the 1940s. After World War II, there was a booming economy. The economy was very robust. And there was a competition for talent, a competition to acquire labor for people to work for your company. And so what companies did, they started offering health benefits to acquire talent and to bring people to work for them. And that was the beginning of what we have today, which is a job-based health benefit system. Now, how is this related to our apathy or our being disconnected? Well, most people have insurance through their employer. And We don't think about our health care until we actually go to the doctor or something happens. And part of the reason is we don't see it come out of our checks. It's pre-tax money. We don't think about it. And that's one of the biggest reasons why we've been disconnected. Now, what are some of the costs of us being disconnected? One in particular is obesity. It's one of the biggest issues in our healthcare system today. 1 in 3 adults are obese in this country. 1 in 5 adolescents, children are obese in this country. Obesity leads to certain types of cancer, type 2 diabetes, strokes. Obesity costs this country $147 billion per year. Another cost of being disconnected is waste. And what I mean by waste is unnecessary procedures, administrative costs, fraud. Waste costs us $750 billion per year. Healthcare in this country is $2.5 trillion of our GDP. So $750 billion that's 30 cents out of every healthcare dollar is being wasted, just thrown away. Now, over the last 50 years, we've had an explosion of innovation, of care management. It's just been a knowledge. With regards to healthcare, it's just been a great time, but we still haven't made a dent when it comes to cost, access, equity. Still a lot of issues. Now, I'd like to put this in kind of a context for us. If banking was like the healthcare system, an ATM transaction would take days. If home building was like healthcare, plumbers, electricians, the other contractors, the carpenters, they would never talk to one another. They would just start building a house, and whatever's done at the end of the day, that's what you end up with. If grocery shopping was like healthcare, you'd walk into the store and there'd be no prices. You wouldn't know what you had to pay for until you got to the register, if then. And depending on what kind of frequent shopper card you had, you could be paying something totally different than the person in the aisle next to you. It's a real issue. So how are we going to fix this? What's going to happen tomorrow? What are our choices? Well, we can sit back and let policy and politicians figure this problem out. How's that work so far? At the rate we're going, healthcare is going to continue to be unsustainable. The elderly and lower income individuals in this country will not have access. And at the end of the day, because of healthcare reform, now employers have to cover their employees. And so if it becomes so expensive, they're going to start cutting jobs, and unemployment will rise if we don't do something about this cost, if we don't do something about it, us as individuals. Now, there's another path we can take. This other path is a grassroots effort where we merge our energy, us as individuals, with today's technology. There are tools out there that we can use right now, that can help us as a group to collectively motivate ourselves to take better care of ourselves, to make a dent in this healthcare issue. We've seen collective efforts like this be successful. Susan G. Komen, started by a young lady whose mother passed away. And now it's huge and it's impactful. We can see it in the pink ribbons we see everywhere. With regards to health and wellness, right now there are 5,800 applications, at least 5,800 applications for smartphones that we can use. How many people in here have a health and wellness app on their phone right now? Most employers now have wellness plans that we can access, and they give us incentives to participate in. How many of us participate in our company's wellness plans? We can leverage social networks that are out there right now. patients like me, Facebook, Twitter. There are ways that we can work together to motivate ourselves to do what's right, to do what's better for our entire healthcare system in this country. With regards to shopping and transparency, there's so many tools out there that can help us make better decisions. There's companies like Castlight Health, Change Healthcare, my company Healthdax. There's so many companies out there that offer tools that we can use. Now, the Chinese character for crisis is the same character as it is for opportunity. In 1927, President Coolidge was the first president to say, our healthcare system is in crisis. And we've heard it over and over again. We still hear it today. But now we have an opportunity as well. And that's where I want, in closing, I'd like to leave this with you. I'd like to challenge everyone that sees this, everyone that's here today, everyone that's out there that's watching. I'd like to challenge you to just find one way each month and just test out a new technology to see how it can impact your health. You may like it, you may incorporate it into your lifestyle, or you may not. But if you do this every month, you'll be looking at ways to improve your health situation as well as everyone around you. And I challenge you, and I know that everyone here is up to it. Thank you.